They care about the bottom line. Yep, pharma dollars, not about the health of the American.
So that's a little startling, I think. That's a little startling. And the reason we're bringing this up again, because I was in that committee hearing, they spent several minutes talking about the Hep B vaccine. And I just want to make a comment here that the CDC says that they are now recommending, they're saying these vaccines contain 250 micrograms of aluminum. And the CDC recommended upper limit for newborns is 18 milligrams, micrograms. So 18 micrograms versus 250.
Yeah.
Now, the CDC, now they're not perfect either. They've made, mistakes in the past, but they're coming around, and that's startling. Why do you want to give a 2-hour-old baby that much?
It's way over the limit. Yeah.
And this raised the question when they started digging into vaccines. Is it the vaccine that's causing problems with some of these children? Or is it the adjuvants, the aluminums that are carrying them through? That is a really strong statement there.
Right. Yeah. So in the comment there by Phil Murphy, at the bottom, it referred to the insurance companies.
Oh, yeah.
That the insurance companies will have to follow whatever the recommendations now of the Department of Health. So, that, first of all, whatever the premium, don't forget, we will always be paying the, whatever the increase in cost is, we're going to be paying that in premiums. The insurance companies are told to cover things all the time. So this is a pretty regular occurrence. There are limitations. If the company fails to make a profit, they can make a decision about whether they want to remain selling a particular line of insurance in the state. So, for example, for the medical insurance, they will have to pick up any costs here. They can't refuse an individual thing, but they can decide, well, maybe New Jersey, we're not making enough money or we're not making any money selling medical insurance. They can pull out of the state, but they would have to pull out by an entire line of business, not by an individual part of that business. So it's not just people, but there's, the insurance companies are impacted, and, no matter what the impact is, it's going to bounce back to us in premiums, and they're already, sky high now for medical insurance.
Do you know anything else about that, Melanie, the aspect of insurance? Or
just that, to your point, that the bill that was passed did say that whatever New Jersey puts on the list, their mandated list, that the insurance companies would have to comply with.
Right.
And so that was a big part of it. And I think it's important to clarify that, in regards to Hep B, that Robert F. Kennedy Jr. and CDC's ACIP, the Advisory Committee on Immunization Practices, they were just asking for, to your point, instead of on first day of life, to receive this vaccine that really was created for IV drug users and prostitutes, basically, that you can push it off and wait until your 2 month appointment with your personal pediatrician, not in the hospital, and make an informed decision. It wasn't eliminating access to the vaccine.